Good evening. I'm Corvallis Advocate Assistant Editor Karen Nixon, and co-moderating with me tonight is publisher Steve Schultz. Welcome to tonight's CitySpeak Forum. CitySpeaks are presented by the Corvallis Advocate, which offers daily news online and in non-pandemic times, a twice-monthly deep dive print publication, along with live forums and storytelling nights. CitySpeaks are co-presented by City Club of Corvallis, which is a volunteer-run nonprofit organization that seeks to present a diversity of viewpoints and constructive dialogue. Steve?
Thank you, Kara. Partial funding for these forums comes from Peak Sports and First Alternative Natural Foods Co-op. However, we could not present CitySpeak without the support from viewers that we get from viewers like you. So thank you for those of us that are supporting us. Please do, if you're not, please do consider a subscription if you're not already a subscriber. Levels are $5 and $10. It takes a whole minute and a half on our site to subscribe. It's an opportunity to do something that is increasingly rare: support journalism that is actually run locally. Kara.
Thanks, Steve. It's currently National Hunger and Homelessness Awareness Week, and this evening we will be focusing on homelessness locally. There have been lots of changes for the unhoused this year. Nationally, social distancing and shutdowns have altered what resources are available to the unhoused, and locally, 3 Corvallis shelter providers have merged and a new county board has been formed. With the mergers and the new board, a clearer picture of future assistance for the homeless will start coming into focus over this next year, and there are already some indicators of how the future could possibly unfold. We'll start with editorial board questions and then move to viewer questions. Viewers can pose questions by commenting on our live post of this event on Facebook or by emailing cityspeak@corvallisadvocate.com. Again, that's cityspeak@corvallisadvocate.com. First, we're going to be focusing on the COVID-19 pandemic's impact on the homeless. And we'd like to welcome first Sarah Hartstein, who is the Health Communities Division Manager for Benton County. Sarah, can you tell us how the pandemic and social distancing response has impacted homeless people and how it has affected their day-to-day experience?
Absolutely. Good evening. My name is Sarah Hartstein with Benton County Health Department, and I think that most folks in our community know that when we were confronted with a shutdown order, that most of us were able to shelter in place in our homes with access to hygiene. And that's a different situation for individuals who are experiencing homelessness, not being able to access their normal services, restrooms, hand washing, potentially proper social distancing, depending on whether they were currently in a shelter or in an encampment. And then looking at other resources that they no longer had access to, which may be a very simple thing like charging a cell phone or accessing the internet, were really challenging. And a lot of our service providers had to adapt what services they were providing to meet the needs during that response. And now we're in a place where cold weather is coming and our shelter capacity is reduced because of prevention protocols indoors. And our community is going to have to adapt again.
Thank you. And could you let us know if homeless people are experiencing, you kind of touched on this, but if they're experiencing different health challenges than most of the population, and have there been any successes in addressing those challenges?
I think in general, this particular population in our community and really across the country tend to have higher rates of comorbidity, so have multiple diagnoses, whether it be a chronic condition, mental health diagnosis, or an addiction. And so that already puts individuals in a challenging place. So again, when we look at recommendations to continue to shelter in place, even when the order was lifted, when we moved into phase 2 reopening, the recommendation was still for individuals who are a part of that medically fragile or over age 65 population to continue to self-isolate. And so that becomes a concern with our community members who are experiencing homelessness. The other challenge is access to healthcare and testing. And then if an individual is positive, being able to access an appropriate space for isolation.
Thank you. And can you talk a little bit about the successes, if you've had any successes addressing those challenges at all?
Yeah, I think we have made some progress, and a part of that progress is because of the collaborations that we have in our community, and the problem solving that we've had to um, engage in together to help meet those needs. And I feel like a lot of our community partners, our jurisdictional partners have stepped up to try to meet the needs. So when the men's shelter had to close early, they were able to be really creative and reopen as a hygiene center to allow for access to hand washing, additional uh, toilets, showering, etc. We've worked to identify locations where individuals can RV or car camp in place. Um, we've the city and the county have both contributed funding to help shelters that were already open remain open longer, so that they could help shelter in place. And there are a lot of other efforts that are occurring to try to meet the needs of the lessened shelter capacity for the upcoming winter.
Thank you. And my last editorial board question for you is COVID transmission disproportionate among the unhoused? Oh, you're muted.
I'm sorry. At this point, we haven't seen that, but what we can say is that, congregate living facilities pose an increased risk just because of the, transmissibility indoors. And so that's a concern. And then when we look at individuals that may already be medically vulnerable, medically fragile, that's a concern as well.
Thank you, Sarah. Steve?
Thank you, Kara. Questions for Paulina Kaiser, Director of Health Outcomes and Health Outcomes Research and Evaluation at Samaritan Health Services. Paulina, in what ways are the unhoused a particular challenge for Samaritan, and are there clues about meeting those challenges? Have there been some successes?
Yeah, so we know from a large body of research that that unhoused and homeless populations suffer disproportionately from higher prevalence of a wide variety of physical and mental health issues. We actually didn't have a good way to try to quantify those issues at Samaritan locally until last year. We actually built a custom registry, as it's called, which is a tool in EPIC, our electronic medical record system, to try to flag homeless patients that we serve across our 3-county service area. There's no kind of one checkbox in EPIC to identify somebody as homeless, and we also know homelessness is a complex issue that can change quickly in time too. So we use kind of 5 different ways, 5 different eligibility criteria to try to identify homeless patients across the system. We know this is not a perfect way, and we're actively working to try and improve those inclusion rules to better capture the population. But as it is now, we've identified about 1,400 patients across the system as homeless, and we can tell that those patients do have more likely to have hypertension, asthma, diabetes, COPD, heart failure, HIV, traumatic brain injuries, twice as likely to have a mental health diagnosis on file, including 4 times the risk of PTSD, 4 times the risk of a bipolar diagnosis, and 18 times the risk of a schizophrenia diagnosis. Also more likely to be co-burdened by both a mental health diagnosis and a substance abuse diagnosis. More ED visits, more hospitalizations, fewer utilization of primary care and preventive resources. So again, these are all patterns that we see at a national level. None of this is surprising, but it definitely presents a challenge to Samaritan. And I think that we have launched a couple of programs that have been successful. So we have a couple of social workers who actually form the majority of our homeless outreach, and they do a fantastic job of establishing relationships with homeless individuals and really being able to make sure that those people have the support and resources that they need to get appropriate medical care.
Okay, and you've got this report you're working on for early next year that's going to encapsulate all of this. What's the anticipated timing for that report?
Yeah, so as I mentioned, so in 2019 we created this this registry to identify homeless patients to the best of our ability across the system. We are currently working on a report to kind of summarize this data and put it in context of what we see from the broader research. And hopefully that will be available in January, early next year sometime. And we anticipate being able to share that broadly with the community.
Okay, excellent. And, I really appreciate the answers, and I'm going to go ahead and move over to Kara now. Kara?
Thanks, Steve. We're now going to be moving on to Dina Eldridge, who's the Housing Services Manager for Community Services Consortium. The CSC works to prevent evictions and to fund the unhoused who are in need of things like security deposits to regain permanent housing. Dina, can you talk about the increase in applications for rental assistance amid the pandemic? And can you maybe be specific about numbers if you have them?
Thank you, Kara, and good evening, everybody. I'm Dina Eldridge. I'm the Housing Services Manager for Community Services Consortium. CSC is the local community action agency for Lynn, Benton, and Lincoln counties. We get various sources of federal and state funding to help people who are homeless get back into permanent housing, as well as to help people prevent homelessness, in other words, stop evictions. So this year, with the COVID impacts and all the shutdowns, people losing their jobs and their businesses, unable to work, obviously it made many of them unable to pay their rent as well. So even though the eviction moratoriums were put in place by the governor, which were certainly needed, it didn't stop the fact that people were unable to pay their landlords what they owed. And when the eviction moratoriums finally do end, they were facing a tsunami of people who could be facing eviction and potential homelessness. So we received, through the CARES Act, through the allocation the state of Oregon got, over $3 million to assist people who are in those situations who've been impacted by COVID and found themselves unable to pay their rent or behind in rent. And we had over 1,500 households apply. To put that in perspective, so far, CSC has spent about $2.5 million, and this is just since May, to help people who are trying to avoid eviction, who've had a COVID impact. And that amount of money is basically equal or slightly higher than our annual budget of all our programs combined. So it's been a tremendous need and a very challenging response, but we have helped at least 550 households, and probably will help at least 100 more before those funds run out. And that's without touching our normal housing programs, which we do still have and will be making available once those CARES funds are gone.
Thank you. And you kind of touched on this already, but what are your concerns for after the eviction moratorium ends, and how will the CSC be helping those people out that are affected by that?
Well, obviously, not everyone managed to get assistance from us. The state and the feds work to make the eligibility as simple as government programs can get, but believe me, that's still not without lots of regulation. So even with those things being relaxed, it's still a process. And as many people found with the unemployment department, if you've never had to tackle applying for government benefits, it's not a simple 5-question, 1-page thing. So we know that there will still be people who didn't get assistance. Maybe they were slightly over income for the assistance. at the time, or maybe there were other barriers that kept them from acting. We are hoping that more funds will come in. We've gotten a lot more funding just recently to address homelessness, especially during the impacts of COVID. But we will have good allocations of our normal program dollars. But again, that was what we had before the pandemic was even a reality for us. So we will continue to serve as many people as we can as long as the money runs out. But the one thing about our programs is the money is not endless, meaning it's not an entitlement program for as many people that need the help. We don't still keep getting money. We have a finite amount.
Okay, thank you.
Thank you.
Now we're going to be moving on to shelter providers, and we're going to be starting with Ann Craig, who's the Executive Director of Jackson Street Youth Services. And how does Jackson Street Youth Services serve the homeless? And do you offer other services to the community as well?
Hi, yes. Jackson Street promotes safety, stability, and well-being for youth. We work to prevent homelessness by showing a path to long-term success through building positive relationships with adults and the community and teaching life skills for self-sufficiency. And we plan to end youth homelessness locally and as part of a movement to end youth homelessness nationally. We do programs that 20 years ago, we're about to come up on 2021, we'll have opened our first shelter 20 years ago, the shelter in Corvallis that we call Corvallis House. We also offer outreach, mentoring, support groups in schools. We are in the RAP teams at the school districts. We work with child welfare and juvenile justice. We have transitional housing for older youth. So we really focused on making sure that when a youth is homeless, we can prevent it when we can, and if we can't, that it's brief, that we can help them and make sure it's the one time. And this is important because I guess if the one point that I'd like to make today is that youth homelessness is a major pathway to adult homelessness. So it's really important to work with those youth, and hopefully they will have a successful life.
Great, thank you. My next question for you is, how is COVID impacting Jackson Street Youth Services work?
Well, COVID has affected families tremendously, and the youth are now at an even higher risk of isolation, abuse, neglect, depression than they were before. So we have to continue to offer our services. So we're still opening, we still have our shelters open. We still do outreach on the street. We still have transitional housing programs. We've had to move a few things to remote or virtual, such as mentoring. But we're providing the programs. And so the challenge is following guidelines to provide those services and to take care of our staff, both physically and emotionally through this time.
Great, thank you, Anne. I've got the same questions now for Ben Danley, who's the Executive Director of Community Outreach Incorporated. Ben, how does Community Outreach Incorporated serve the homeless, and do you offer other services as well?
You bet. Thank you, Kara. Yeah, if you won't mind giving me just a moment for gratitude in this week before Thanksgiving, I wanted to say that the folks who support COI are so important to us, and I just wanted to thank them. COI does provide a wide variety of services to people with either very low or no income, including medical and dental clinics, behavioral health services, preschool childcare. We do food distribution, and one of our kind of cornerstones is our transformational housing program for men, women, and families.
Great, thank you. And another question, how is COVID impacting Community Outreach Incorporated's work?
Yeah, for for most of our services, we're still able to provide them in some fashion. So, for instance, our behavioral health services have gone to telehealth. We're not seeing people in person. Mary's Place, the child care facility, is doing emergency child care. And then probably the largest impact to us is that we've had to decrease our shelter capacity to from a maximum of about 70 per night in pre-COVID times to around 35 to 40 now. And unfortunately, we're also not able to do our emergency sheltering, which is something that we've done for many years, and we aren't able to do it at all now.
Thank you. Steve?
Thank you, Kara. I will go ahead and move to Sean Collins. Sean is Executive Director of Unity Shelter. It's a brand new position for you, Sean. You're director of an organization that did not exist a year ago. You've been busy. It's a merger of 3 shelter locations: the women's shelter, the men's emergency cold weather shelter, and Safe Camp. First, what we'd like to have the audience kind of gain a sense of is what motivated the merger, and what services is Unity Shelter offering now, and what are Unity's goals for the future. And I'm going to actually give you about 4 minutes because that's a whole lot. What motivated the merger? What services do you offer, and what are you looking at for the future?
Sure. Thank you, Steve. I appreciate the opportunity to talk tonight. The mission of Unity Shelter is really providing safe shelter through collaborative care. And I think the big motivation for the merger of those 3 programs is tied up in that collaboration. We've been collaborating as different programs for some time. The men's shelter and the women's shelter kind of held hands for many years in terms of programs and policy. And when we fired up the men's shelter at the current location, we built on the policies that were in place at Room at the Inn. And it turns out many years ago, Room at the Inn built their policies on the former men's shelter many years ago. So there's been a long history of working together. And then as Safe Place started up, which is really a transitional housing program, many of the people that have been involved in Room at the Inn and the men's shelter got involved in the steering committee of that program. So it just made sense to be able to bring those programs together and kind of cover what I would say is the low barrier end of the housing spectrum in town, and try to find ways to gain some efficiencies across the programs, make sure that we were collaborating in terms of grant opportunities and funding, that if there are staff policies and even staffing opportunities where we can share staff between programs, that we would do that, and kind of make it so that it's a lot more seamless across that spectrum of services. So that's kind of the motivation there. I think in terms of plans going forward, as we walked into this year, I think everybody expected that Unity Shelter would kind of bump along on a fairly quiet path for some time. And, in January, that looked like a reasonable thing, that we would probably have a year or so to ramp up our operations. Both the men's shelter, the Safe Place was already essentially a year-round program, but the women's shelter and the men's shelter were both seasonal programs, and both of them had aspirations to go year-round. The women's shelter, of course, in March went to 24/7 operations and has been operating nonstop since that time. The men's shelter story is a little bit more complicated there, but I think when you look down the road for these programs, I think it's about trying to make sure that we've got adequate year-round shelter for men, women, and hopefully families. We're not able to do very much for families right now, though in the Safe Place program, we do have some micro shelters that are occupied by women with children. But I think that as we go forward, trying to work on non-congregate shelter solutions, trying to broaden the spectrum of what we can offer is really important. I think that the family shelters pretty limited. I think COI does a great job of providing that, but there's still unmet need, and there are people that aren't appropriate for COI that still need to have a place to go. I think that there's also, just when you think about the LGBTQ I population in town, there's not really always a great set of options for shelter for that population. And I think that being able to have culturally appropriate shelter opportunities is a big target for us going forward. I think that that's just, I'm just kind of reeling because I've had a lot of conversations about this just today, about cases where people are, we've got people who are non-binary or gender fluid or in transition in some way, and trying to find a safe and comfortable place for them to find shelter is very difficult. And so I think that's a goal that we have going forward. I don't think that we aspire to be, the 800-pound gorilla of shelter, right? We don't want to, we're not seeking to take over everything. But I think what we want to do is make sure that across that spectrum of men, women, and families that need low barrier solutions, we want to be there.
Right. And then just in really specific terms, how is COVID, the pandemic, impacting your operations at the 3 locations?
A lot. So I mentioned the women's shelter. I think that they've been, Room at the Inn has really been kind of a model in terms of trying to provide 24/7 shelter and really very safely provide isolation in place, right? Let's shelter in place and make sure that they've done a great job educating their clients. They've made sure that they have all the PPE they need. They've had to really ramp up their staffing and engagement with their clients to be able to make that work, and do a lot of education and outreach to folks to make sure that they understand the risks and how to keep themselves safe. The men's shelter, I think it's, in March, we basically shut down as an overnight shelter. We could not at that time really provide the congregate shelter. We had 50 beds, and we could not safely keep people inside and think that we were doing them any kind of service. So we shifted to the hygiene center model in March, and have been operating 7 days a week since that time, providing showers and laundry and food and a lot of information. I mean, if you think about what the shutdown has meant to access to information for people who are homeless, it's been pretty dramatic, right? The library is shut down. That eliminates a lot of Wi-Fi access, a lot of access to other information. They're not able, although the drop-in center has stayed open, they're not able to actually get inside, and so that whole dynamic has changed. They're not able to get into a lot of other services. So being able to provide information not only about the pandemic, but also just what is available in town, what's the future look like, has been very helpful. At Safe Place, that program has kind of grown a lot during this time, because while we had some micro shelters built, we were still thinking that it was going to take kind of several months for us to get through a permitting process and work through negotiations with the city and county about how to occupy those. The city and county both were very prompt and very quick to jump into action and say, hey, you've got these in place. Let's get people who are medically vulnerable into them as quickly as possible. And so we very quickly started a program to do an intake and review people, partnering with folks like Samaritan to identify medically vulnerable people who really were at greater risk if they did not get into those micro shelters and have that opportunity to shelter in place. So that has both, that's worked very well with the 12 micro shelters we have in place now. We're expanding. We're in the process of building another 15. So that program has grown quite a bit.
Now, where are the micro shelters again?
So we've got 6 of them right now out at Safe Camp, which is out on West Hills.
Right, you got another 6 elsewhere?
Yeah, we've got 4 at the First United Methodist Church, and we've got, actually, I guess we've got 13, because we've got another 3 at the Corvallis Evangelical Church.
Right. Great. And then these additional 15, when are those going to be up? Where are they going?
So they should be placed in the December, January timeframe. They're still under construction. And we're still working out the location. So there's the likely path is that there'll be a few more that will end up out here at Safe Camp. We've got room to do that. And we're in conversations with the county about how to make that happen. But I think the intent is to have them in different locations. So I'm not going to out anybody right now about locations, but I do know there was a church that I identified today and saying, yes, we want to do this. There's been a little bit of challenge in finding locations, but I think we're working on placing some at the men's shelter. We've got at least 2 different churches that are interested in placement right now. If there's any businesses out there that are interested in having this on their property, that is still within the bounds of the permit process at the city. So that would be a good opportunity. There's a lot of businesses that are not using parking lots in the way that they were 6 months ago.
Now, some of that challenge comes from neighborhoods or.
Well, I think that Safe Camp, if you've kind of followed the news about Safe Camp in the last 6 months or so, there was definitely some challenges in the neighborhood with folks. It was a challenging thing to have a managed camp suddenly pop up in the area, even though there was a lot of homeless camping in the tree farm adjacent to this property. And has been frankly for 20 years.
Right now, and at this point, you've been coaching. My understanding is that the management at Safe Camp is, in fact, supplying some coaching to the neighbors about how to work with the homeless who are still in the tree farm and are not in the managed camp. Is that the case?
Yeah, I think the relationship with the neighborhood has evolved a lot. And I mean, we've learned a lot about how to work with them. I think they've learned a lot about what our intent is and how to work with us. And we're having monthly meetings with the neighborhood committee. And part of what we're doing is helping them understand, like, some of the people who are in crisis who might show up on their doorstep aren't actually Safe Camp residents. They may be folks that are in the tree farm. And there are resources that they need to call on, the mental health crisis line, the non-emergency number. There are resources available. It can be challenging. I mean, I think mental health supports in Corvallis can sometimes be very limited, and particularly crisis response. But I think that frankly, it's education coming both directions. How to be good neighbors works both ways.
Great. Thank you, Sean. I'm going to go ahead and move to Kara.
Thanks, Steve. We're now going to welcome Andrea Meyer, who's the Executive Director for Corvallis Housing First. Andrea, could you tell the audience a little bit about how Corvallis Housing First serves the homeless and if there's any other services you guys offer?
Corvallis Housing First was originally the Corvallis Homeless Shelter Coalition, and we operated men's shelter off of 4th Street. In the last several years, we've gotten out of that service, and thankfully Unity Shelter has taken the place where we once offered that service. We currently own 3 different properties where we provide housing based off of a housing first model, which is doesn't require sobriety, but it's behavior based. So it's basically if you can follow your lease agreement and follow some basic behavioral rules, you can live in our housing. We also provide some subsidy to people that come into our housing as well. And so in addition to the housing opportunities that we provide to people that have experienced homelessness, we provide case management services. So everyone in our housing is assigned a case manager, and really the goal of that relationship is to help the person achieve any goals that they would like to achieve, hopefully focused on self-sufficiency, housing stability, and well-being. As discussed earlier tonight, a lot of the people that we serve have significant health challenges. So that's something that we try to help coordinate, and we certainly partner with everybody here tonight to help serve our folks. We have a unique partnership with Unity Shelter in that we provide case management services, outreach case management services at the men's shelter, the women's shelter, at Safe Place. We also provide some services at the Corvallis Daytime Drop-In Center, because really our interest is in forming a relationship with people that are experiencing homelessness. So once they move into housing, then we can continue to help them work on their goals.
Great, thank you. And could you talk specifically about how COVID has impacted Corvallis Housing First?
At first, it was really scary. And there wasn't a lot of guidance on how to address the issue. We struggled with that for a little bit. Thankfully, luckily, since we're providing housing, most people have, they have a place to shelter in place. So really, it's about just trying to help people understand what the risks are associated with COVID, trying to provide folks with PPE if they need it, masks, hand sanitizer, trying to make sure our housing is safe for people that are living in it, and really supporting the work of our partners in the community to provide services. So for example, we've continued to provide street outreach every week through the SORT team and coordinate volunteers. That's been a pretty amazing thing when people are trying to shelter in place and a lot of people are working from home. Our volunteers continued to go out on the street to bring basic supplies and to try to support people that are living outside right now. Yeah.
Thank you, Andrea, and thank you to all of the shelter providers. Actually, one of the residents of Corvallis Housing First has agreed to speak with us tonight, so we're going to ask him some questions. Steve?
Hi, Shane. We've talked before. You can go ahead and unmute yourself. That would be great. So you and I spoke, I believe it was last week, and you've got a story where you're now housed at Corvallis Housing First, but
Yes, sir.
You grew up homeless and you've got a daughter now, and you're looking to break some cycles. I think could we just get like the 2-minute version of your story, and I'm going to give you a couple follow-up questions. That's a lot. There was a lot there. We spoke for almost 45 minutes, if I recall. Yeah.
Well, real briefly, I became homeless the first time between the ages of 6 and 7. My mother was a single parent. She went through a nasty divorce, I guess. I'm not really clear on that, long time ago. But we wound up, my daughter and I came here to Corvallis about 5 years ago, homeless. And we stayed at the shelter, COI, a couple of different times. We couch surfed, we basically just tried to make do. And I got a business card handed to me one day, and was told to contact CHF, Corvallis Housing First, and talk to Jennifer McDormand at that point. And I called, we talked, we set up a meeting. We met a couple of different times. Right from the get-go, her point being was, we need to get you into some place to live right now. We don't need to wait and do this and that. Let's go ahead and get you in right now. It did take a little bit, but once we were in, Andrea being one of those has made it really clear that living here, it has opened up a myriad of possibilities for me, but more importantly, it's given me a confidence to start to really open up. It's given me finally a time to find out who I am and what's going on in my life and why I've been homeless, from the time I'm 7 years old. So having that safe place to be and not have to genuinely worry about your home every day, it's allowed me as a human being to grow and to understand where my issues were coming from, where my past drug addictions, where my past run-ins with the law and the criminal activities and all this stuff. Just being here and knowing that I'm safe has allowed me to confront this stuff and start to overcome these huge amounts of conditioning that I didn't realize I had acquired over the years, of dealing with different organizations. CHF in the way it deals with its residents and the people that they help out is genuine, and it's each and every person that I've interacted with that has been a part of CHF, they're genuine people. They aren't, you don't get the feel that they're helping out to feel good about themselves. They're helping out because they understand that that's what people do for other people, period.
You said something interesting when we talked. And you just said, that at some point or another you got clean, and you told me that story. And I think there's some compelling element to that. How'd you get clean? I mean, tell me physically, how'd you get clean?
I had been continuously high for, it was maybe a month straight. I know I hadn't slept in at least 11 days, more than a couple of little micro sleeps here and there. So I was really, really not present. And I got involved with some guy. He wanted to go and do some type of criminal activity. And right in the middle of it, I realized that more than anything, I didn't mind if I got hurt, but I knew that it wasn't going to end there and someone else was going to get hurt.
And at
And
this
for the
point,
first
you're
time
strung out heroin for a month. You decided to walk away from doing a criminal activity. What's next?
in the middle of it, yeah.
Yeah.
It wasn't anything that I consciously said, okay, I'm done. It was just a big, I've got to get away from there. I've got to leave. I've got to stop this. I've got to be done with this. This isn't what I want to do, and
So it's sometimes called a moment of clarity.
yeah, big epiphany, I just realized how much of my life up until that point had just been predetermined for me because I just kept following in the same path.
Okay, so you've had this moment of clarity. What's next?
Really, I mean, I spent 2 weeks holed up in a motel room, and if it wouldn't have been for a friend of a friend's person being involved, I don't know if I would have made it the 2 weeks in there, but
She was a maid at the motel, right?
yeah, so they're Motel 6 actually in Salem, Oregon, right there. Yeah,
So you checked yourself into a Motel 6 to
lay down
detox from a month of heroin on your own.
The whole point wasn't to really detox. I kind of went there to die. I mean, that's kind of what I figured was going to happen, and I wasn't upset about it. It wasn't something that I was going to try to stop. If it happened, it happened, and maybe it would have been better. That was my thinking. It hurts even now to look back at myself then because, man, I feel so bad for that guy. I want to give that guy a hug. Let him know that stuff does get better, man. You got to stick in there, and you have to be willing to continually put yourself out there and ask for help when you need it, not when it gets so bad that things just crash down on you, but when you need it. And CHF has been one of those go-tos for me, anything that comes up, I'm like, oh, well, I'm going to give Andrea a call, or I'm going to give Ilea a call, or I'm going to call Tatiana, or I'm going to call Dan, or I'm going to call, somebody. And even through DHS, I've got a couple people that I can contact immediately. And for me to be able to say and mean that now it's taken a tremendous effort, a force of will to be as open and to be as vulnerable with anyone in that position, because normally up until a few years ago, every interaction was a horribly negative one. It either wound up with me being in jail or losing this or being put here or something like this. And over time, it got to the point where, You want to be the smooth stone. You don't want to be the sharp stone. You want to be the smooth stone. You don't want anyone to notice you. You just want to get through everything really smoothly. And unfortunately, that doesn't work out.
And so you're in a whole different situation than you were when you got clean. You've had some time, and have you thought about what's next?
Yeah, I've been a salesperson, most of my life, and I'm good at it. It's something that, a lot of my past and my upbringing, it contributed to my being a good salesperson. I read body language really well. I understand intonation in the voices. I just catch little things, and I'm able to fit myself into what people need. And it's nice to do it in a positive way and to have someone smile about it instead of being like, oh, you know what, you ripped me off. I didn't see that coming. So I've been thinking a lot. I've been looking into it, and I think I'm going to get my insurance license. I talked to one of the agents here in town, Julene. She's with Farmers right there, and she turned me on to some really good information. So that's what I'm looking forward into trying next, is to try to get my insurance license and to sell insurance. I mean, it's a business where it's always going to be there. Everybody needs insurance.
Yeah. Well, Shane, I appreciate you taking time with us.
Sure.
Your story is amazing to me. Just an absolute, just keep doing what you're doing, brother. Okay.
I got
Kara.
a lot of help. I got a lot of help.
Oh yeah.
Thank you guys.
Kara.
Lastly, before audience questions, we're going to examine the contemporaneous public policy locally and look speculatively around the corner into the next few years. Steve?
Biff, I'll start with you. You're Corvallis' mayor, so here we go. There's a view among people returning to Corvallis after some time away. There's been a few of them that have come back that are kind of in the orbit of the Corvallis advocate, that have returned after a few years into this community. And they have remarked that the presence of homelessness downtown, especially downtown, is just remarkable. It's like night and day. They thought people were working on this, but there seems to be far more presence of homeless folks downtown. Could you speak to that impression?
Well, I don't disagree with that impression that, in particular, the past 8 or 9 months in the COVID period, and I'm not sure which time frames you were talking about there, but we've had a growth in the homeless population. A variety of reasons for that, whether it's economic, housing difficulties in town, or in some sense, doing some level of improving services while other towns are sending people this way. And it's a whole mixture of those, and I don't want to point at any particular one of those. So I'm not sure the time frame you're asking about. I do know that as we got into the COVID time frame, and you heard descriptions of the various shelters not being able to, for health reasons, to either stay open for the emergency shelters or having to do reduced capacity. And part of what the city did at that time was, even though camping was illegal in the city, and there had been, I would describe it as a modest ongoing enforcement of camps, what the city decided to do in March was to not do that enforcement for multiple reasons, one of which is the being outdoors was safer than being pressured into getting indoors, and the indoor places were being closed. So how do we allow people to survive while we're all trying to understand what to do with this COVID virus?
To be clear, at this point, we know other cities are sending us their homeless. Are we clear about that?
Yes. I don't know the quantity, but yes, there are.
How do we know that?
Most of it's anecdotal. Okay, thank you, Shane. I was going to say, we have anecdotes. And it's not just in the past 8 or 9 months. It's been ongoing.
Wait, do we know
and,
what cities or?
I guess it's a whole range of cities, local, regionally, more broadly regionally. I do remember one case the men's shelter was dealing with that I heard from a number of the folks there that had to do with very ill individual who had been down south of us at the Green and Yellow City.
And
so
as you can anticipate, as you may have anticipated, there will be quite a number of questions about camping later. But there was some activity from City Council last night.
Well, this has been, I think, a big step forward was made last night. In my own personal opinion, part of that was City Council got fully engaged on adding to the direction that staff was working with, that they had given 2 council meetings before. Staff had been responding to the fact that as we got through the looser time in the summer and the good weather, and there seemed to be a growing number of problematic camps. Fire safety was a big one while it was still dry. Now that it's raining, it's less so. But there was also environmental impacts, human waste, all of that was getting to a point where some of it had to be dealt with. So staff developed a plan. They brought it forward to council late September. And it was a plan that went all the way through rollback to where we started, which I think was not appropriate for being in a COVID period. And we need to understand how to deal with that.
So what's council asked the staff to do then?
Well, so the history of it. So finally last night, council got more engaged and basically concluded a number of things and directed staff. One is to begin working with Unity Shelter about managing the camp around Unity Shelter. Doing more management of it, I think, is probably the most accurate way of describing it. Treating it still as a temporary camp, because one of the challenges that staff, city, county staff working with the service providers, and we've all been in the middle of trying to figure out how to solve this. You're asking me as the mayor to describe it, and what I'm describing is the work of tremendous work of a broad number of service provider organizations that you've already heard. You've already heard how they how they work together, how we're trying to support them. I got lost in some of that discussion, but the key was Unity Shelter. In some of the discussions we went through the summer, it was this question of, with some city staff about, well, do managed camps work? And I had pointed out to me one of the aha moments that, well, yeah, there's an example in town, and that's Safe Camp or Safe Place, however you want to call it. It still has evolved, continues to evolve, but it is one that does work, and we have an organization that has the skill to do that. So that was part of trying to get that moved forward in a more formal fashion. So one item from last night was, okay, sit down and start actually negotiating with Unity Shelter, working with Unity Shelter to develop a more managed camp around the hygiene center. Part of that was triggered also by Sean Collins' testimony last night at community comments saying, I'll translate part of it as, we're here to help do that, but we need to get fully engaged and we need to figure out some funding sources. So second part there is later in the council meeting where council was dealing with CARES dollars that needed to get dealt with before the end of the year, gave some redirection to staff to set aside part of those CARES dollars to be able to use to begin to fund what it is that Unity Shelter might have to do to be able to manage a camp around the hygiene center that it operates. The second thing it did was to say, let's do a similar kind of improving the operation or formalizing what's going on in Pioneer Park, where there's RV, and the council's direction was RV and car camping at the time. But it's not tent camping, but it's vehicle camping in the parking lot there. Instead of having it be ad hoc and informal, begin to work through what that looks like and how to make that more supported. So deal with both of those is saying we're in this COVID situation. We've got to have some forms of more structure around how people are who can't get into other facilities, who can't get into congregate housing, non-congregate housing, get into housing, period, still have a safer place to stay than having to wander around town and find a place to stay, and a more structured one. So that's a first step forward. More to come at the next council meeting.
Next council meeting is December 7th.
7th. And it's not that those are going to be where there's a proposal brought forward. The direction on working with Unity Shelter about the organizing camping around the hygiene center was very direct, and go get started on figuring out what does it take.
So right now, how much funding was arranged?
Well, what was redirected was $124,000.
Does Unity have access to those dollars at this point?
Not today, no. I mean, it takes to be able to make this work and make sure the state and the federal government don't come and take it back from us. I think Dina talked earlier about some of the regulations and the like.
Sure.
We will have to have an agreement with Unity Shelter. We will have to front end load the funding on it, and that'll be things that have to occur over the next.
I'll move to Sean for just a minute. Sean, when are you going to get started? You knew that had to be coming.
I think the start was, I mean, we've been engaged with the camp around the hygiene center since March. And so that start really is kind of trying to understand what's going on down there and what can be done. The proposal that, I made in community comments was based on a budget that I think needs to be gone through pretty carefully with city staff to make sure that that if there are any resources that the city already has that we might not actually have to put into the budget, such as fencing, other resources, we need to really fine tune that and make sure that we're dialing in that number correctly. We need to work with parks to understand where in that property we could do this in a safe way that respects the needs of the Parks and Rec to protect different areas there. And I think, based on my inbox today, I would say that process has already started. So,
what are the services that the folks in that camp need most quickly, do you think?
Well, I think most quickly, you need to have a safe space where, and that's part of the intent of having a fenced area with some site control and some staffing is that, if you're living in a tent, you're living in a big nylon bag, as one camper recently described to me. And so if you're living in a big nylon bag, you don't want to leave a lot of your belongings in there and walk away very far. I think that it's important that we provide a safe space. That it's secure, that their belongings don't walk away because they need to go out and get services, go to the drop-in center, connect with healthcare, etc. I think that the access to food and hygiene is pretty critical. And I think that's one of the advantages of doing something like that by the hygiene center is we're already set up to provide food and hygiene and laundry service and things. And over the summer, through the help of the Benton Community Foundation and United Way, we were able to pretty dramatically increase our laundry capacity there at the shelter. So, I mean, we can help people a lot to live better in that space. But
there's been some comment from the community that there seems to be a lot of debris from the homeless on the site. That's going to start getting taken care of.
Well, so there is a dumpster there that has been provided by through the EOC, the work of the EOC early on in the pandemic, and that the good news there is that there's a dumpster. The bad news is that sometimes members of the community who have large trash items that they don't want to take to the dump and pay for avail themselves of that opportunity, and so we regularly find appliances and furniture in the dumpster, which takes up a lot of volume. So that's part of what we need to do down there as well, is work out, okay, how do we manage the trash better? There's some conversation that has to take place with the city about who's responsible to pick up that trash. Because frankly, right now, while I probably shouldn't say this in a public forum, but our staff are often out there picking up trash and doing things, but that makes Parks and Rec very nervous. That's really, from a liability perspective, that's an incredibly dicey thing for us to be engaged in. So we need to work that out.
If you were going to say.
Well, I was going to point, we keep coming around to things that have to do with managing, provide some level of site control, the ability to dump large items in the trash in the dumpster becomes less possible when there is site control. I would also point out that as Sean went through some of those services like site control and working with the campers, there's also the community, I think, will gain value from having this more value. There has also been, we've been hearing a growing concern about the camp in the park there and safety issues and the like, and the new multi-use path going through. Is that safe or not safe? Are people going to use it? Those are some of the things that have to be worked out between the camp manager and the city and the county, and who are the organizations that are responsible for a variety of aspects of regulation and public safety and public health on those.
And so the public's informed, cohesive plan by the December 7 council meeting, or that's just a check-in?
It's to get as far as long as we can, as quickly as possible, I think is the sense of the direction last night. It was not bring a plan forward on December 7th, which lets staff just do planning. It was actually the direction, and I don't have the words in front of me, was city staff should begin to work with to develop a managed camp, temporary managed camp next to the hygiene center.
Anything to add, Sean?
Just that I think that, the only way that Unity Shelter has been able to function broadly, and particularly in terms of the hygiene center this summer and into the fall, is through a lot of partnerships. And the city and county have been very key in that partnership. CSC has been a big partner, Corvallis Housing First, Samaritan Healthcare. I mean, we've got a lot of folks that are engaged in trying to work with people experiencing homelessness in our community. And it's going to take all those partners to make this work going forward.
Okay, Kara, I'll move over to you.
Thanks, Steve. We're now going to be moving on to Benton County Commissioner Zan Ogerow. Zan, so the county either has started or will soon be starting a community survey concerning the areas unhoused. Could you let the audience know what's motivating the survey, when the survey will start, and about how long until the community will see the results of that survey?
I actually may punt some of this over to Julie Arena, who works for the city and the county as our Hope Advisory Board staff person. But I can start out. The survey that we are undertaking is to learn more from everyone in the community about how they think that we should best provide 4 key services to the homeless community, to provide a continuum of supports from emergency shelter all the way up through permanent supportive housing, that like the housing that Shane lives in, provided by Corvallis Housing First. So that survey is available on our website, and we are taking it out on the streets through the street outreach team, through the daytime drop-in center, so that we can get responses from everyone, from the folks that are experiencing homelessness to the neighborhood associations, to Downtown Corvallis Association, to Philomath Services Consortium, the Amigos de Monroe down in Monroe, out to Kings Valley, you name it. Because we know that this is not just a Corvallis problem, although we're really focused here on Corvallis much of the time, because it's a much more visible problem here in Corvallis. And homelessness tends to look different when you're out in a rural area. It's much more likely to be RV or car living, or being doubled up, probably tucked up along a forest road, or on someone's farm field. And so we want to understand the scope of the problems and whether we've got the right solution set moving forward for the HOPE board that we can then elaborate on and take to the City Council and to the Board of Commissioners for adoption of a big picture vision that we think can then start recruiting funding for, so that we can put these resources into place or build more resources under COI and CHF and Jackson Street Youth Shelter to make sure that we have a full system to support everyone. I'll pass it to Julie.
Yeah, go ahead, Julie.
Sure, thank you. I'll just build upon what Commissioner Ojero started with. We have 4 small surveys for our 4 priority topic areas. And the advisory board looked at the available data and did research on what a model system looks like, and also looked at the gaps that we have in our system here in Corvallis and throughout Benton County and the services that we do have to adopt 4 priority areas 2 weeks ago. And then the board put together surveys on those 4 topics. So they are available. They just went live today on the Hope Advisory Board website. And anyone in the community who would like to have their voice heard to chime in on these 4 priority topics, the community input will help shape the policy recommendations that the board puts together. The goal is to collect public feedback until the end of December. So you have a month and a half to go take those surveys. It'll probably take you about 8 minutes to do all 4 of them. They are fairly short. And then in January and February, the board will look at that public input and incorporate it into the policy recommendations. The goal is to have those recommendations to the city and the county in March as they start their budget discussions. And the other component to that Commissioner Ojero touched upon is an in-person client survey that I put together in conjunction with our community providers who are still doing in-person client services. So there's 8 different providers throughout Benton County, and I'm delivering those hard copy surveys tomorrow morning and on Thursday morning with some other items like socks and gloves and batteries to thank people if they participate and take the survey, to make sure that that feedback is included as well.
Great. Thank you, Zan and Julie. And we actually have a few more questions for Julie. Steve, I'll hand it over to you. You're muted, Steve.
Julie, thank you. And sorry, I was muted there. Okay. I guess question 1 is, this is a fairly new board. The county and or city, they've had a couple of different board formations, if you will, these last few years. The HOPE board is a different board. How's it different? What are the goals?
Thanks, Steve. I think it's different because we are at a different point in time. A lot of efforts have been tried before, and people have been working on this problem for years and decades. And the community has learned from those different efforts. And this board was an evolution of that work and is really built on the foundation of work that's been done before it. The difference really being the elevation of this board to a joint city-county effort, where we have county commissioner and 2 city council members, business community representatives, community services consortiums, acting director, and also an intergovernmental agreement to fund a full-time staff position in the HOPE program coordinator position that I have, because all of the efforts that have happened before this have really been providers who already have full-time jobs and families and are at capacity, trying to come together to coordinate and collaborate. And we needed a full-time staff person to do this, to do the research, to do the outreach, to coordinate all the different people, to bring us all together and to make sure that the whole community is included.
Okay, and then before taking this job, you've had similar roles in other communities in dealing with administering services for the homeless community. And in our conversation, you suggested some possible paths forward in terms of a kind of a multi-use campus, if you will. I know that's speculative right now. Could you talk about that a little bit? Really, it's going to be speculative, just kind of a rough draft form of it a bit.
Sure. The data that the board has done and the research that they did on what a model system looks like points to co-location of services. and having services not spread out in multiple different locations. But when you co-locate many different services, you can meet the needs of an individual in a variety of different ways when they walk through one door, instead of having them have to go to 9 different places all over Corvallis or Benton County to get their needs met. The other thing that has come out of the research that the Hope Board has done is that we have needs throughout Benton County, not just in Corvallis. We have homeless children in Philomath and Alsea and Monroe. We have disproportionate populations being represented in our population experiencing homelessness, particularly our community members who are Native American and Black and Pacific Islander. And so the vision that has come through some of this data and research is an idea for a long-term goal of co-location of services with emergency or transitional beds for different populations that meet the needs of different populations. And as other people have mentioned on this call, there is a real need for what we call SRO, or single resident occupancy, emergency sheltering and transitional sheltering for our community members who are non-binary or gender non-conforming, for the medically fragile, for people who are staying with their children and they need a locking door and not a tent. And so the idea of a campus has been one that has been talked about based on where the data is pointing we should go, and where a model system says we should go as far as co-locating services. And so imagine something like a Portland Central City concern that has quite a few resources in one location, but on a campus-like setting, so that you have shelter beds for different populations, and you can do that in a safe way.
About how many acres, just roughly, all you can do now is guesstimate, right?
Well, in my dream, Steve, it would be about 100 acres or so, but that is so far ahead of where we are now with our planning process.
How many square foot of building do you think?
What's Central City concern? 80,000 square feet? But that's part of the survey process too. And tomorrow night at the Hope Advisory Board meeting from 4 to 6 p.m., an hour of that meeting is going to be dedicated to community feedback and discussion on this topic of location. So for people who want to chime in and give feedback on that topic of what are the desirable attributes of a location, what services can be co-located and should be co-located, what different populations need different areas to be able to address their needs as far as sober or non-sober, men, women, non-binary, etc.
Now, in terms of location for something like that, it almost eliminates trying to put anything into downtown core because there's just not the room on some level. Has anybody looked at potential locations?
No, we're not at that point in the process yet, but I think you answered your own question about downtown. No, there are not 100 acres downtown in Corvallis, but there are lots of acres in Benton County, and there's a lot of need outside of Corvallis. Even though our homelessness is more visible here, we do have need throughout the county.
Now, when we spoke, it seemed like no matter what, bus services would need to be realigned for that location a little bit. Is that the case?
Well, I think we're getting down to the nitty gritty on that, but yes, absolutely. I think one of the attributes of a successful location is that there is public transit and access to a bike path or walking routes, of course.
Okay, great. And then services would be closer in because you would build them out.
That would be how you would co-locate services in a successful model, yes.
Okay, great. Okay, good. Okay, good. So, I think we can move over to audience questions. Actually, before I leave that, this survey, I don't know if we've been sent a link to the survey or not. If you send that, we will go ahead and ask our readership to please participate.
Absolutely. They went live today, so I'll make sure to get that to you, Steve, and there should be a press release out tomorrow too as well.
Perfect. And we'll get it done for you. Okay, great. Because I know you want to hear from the most people you can. Okay. And actually, I'll go to the first viewer question, and it's going to be for Paulina. So in Samaritan's role as a provider, how do you see COVID impacting the homeless population in particular?
Yeah, I think we've been pretty fortunate in that we haven't had large outbreaks of COVID among the homeless population. And I think a lot of that is due to a large amount of work by the outreach teams and the people that have gone out to be very proactive about providing education and sanitation and all of the the basic prevention strategies that that we all know about. So I think so far COVID has not had a huge impact in terms of outbreaks among the homeless due to a lot of proactive prevention.
Now, is that more, and maybe I don't know if I should be directing this to you or to Sarah. Is that more that locally we've kind of dodged that bullet, or is that in general you're seeing that service providers throughout most communities have kind of got a handle on that?
I couldn't speak to other providers. I don't know, Sarah, if you have any other thoughts.
Yeah, Sarah, do you have any insight about that?
Yeah, a little bit.
Okay,
we'll see if I can add to the conversation. I think that, in Benton County specifically, our case rates have been pretty low in comparison to other counties in the region to this point. And right now we're seeing cases increase. And so along with the cold weather and folks moving indoors, we're going to see additional community spread, which unfortunately may impact our folks experiencing homelessness in a different way than it has now. I think the other thing to remember is that COVID may be spreading through our homeless population in a way that we're not recognizing, because they may not get tested in the same way that other folks may. And so that's another thing to take into account.
Okay, thank you both, Sarah and Paulina. And Kara, I'm going to go ahead and move over to you for the next questions from our viewership. Kara.
Thank you, Steve. I'm going to start out with a question about mental health services to our shelter runners, and then maybe Steve, you can follow up about some of our questions related to addiction. I'll start with Anne, and I'll pose the question to all of the shelter providers. How many of the homeless find themselves homeless because of a lack of mental health services?
The youth find themselves homeless because of family dysfunction, not because of a lack of mental health services. They're suffering from trauma, and therefore they need mental health services as well. Or their families may be struggling with mental health issues or addiction. But the youth themselves, although they do need mental health support, which is why Jackson Street has their own mental health counselor, is important, but it's not the cause of homelessness. It's really family dysfunction, which poverty has a huge impact on, as kind of root causes.
Great, thank you, Anne. I'll pose the same question to Ben. So to your knowledge, how many of the homeless find themselves homeless because of a lack of access to mental health services?
Yeah, I think one of the things that's really important to keep in mind is that the homeless is not one population. It's such a spectrum of folks. In COI's case, we have a higher number of folks who are temporarily homeless or who are situationally homeless. And I would say that they are very often, as Anne pointed out, they are not homeless because of mental health failures or mental health system failures, but certainly they do deal with a lot of trauma because of their homelessness. I would guess that Sean and maybe Andrea, who deal with a larger number of chronically homeless folks, might have a different answer, but I would say that for us, it's a relatively smaller percentage of folks who are homeless because of failures in the mental health system.
Thank you. Sean, I'll pose the same question to you then.
Well, I would definitely second Ben's comment. I think it's important to recognize that, the homeless is not a monolithic block. There's a very diverse set of needs. And I think that as many people as you meet on the street is as many stories as you're going to learn about how people ended up there. I do think that there are definitely cases that I run into daily where you see people with untreated mental illness or inadequately treated mental illness that that leads to problems in terms of keeping their rent paid, in terms of managing their apartments or living situation that might result in a loss of job, and getting that kind of situation straightened out can be a big challenge, right? That these are people that, with the right kind of care, can be functional and manage their own lives, but for whatever reason, they may not be getting that adequate care right now. So I would really hesitate to try and give you a number of how many people really are driven into homelessness by mental illness, but it is often a factor, and I think in our community, if you're not in the severe and persistent mental illness category, it can be extremely difficult to get the mental health care that you need. So it's certainly a factor.
Thank you. Andrea, lastly, I'll same question to you.
I would say that I agree with Sean. First of all, there's a huge range of mental health issues. Some people struggle with depression and anxiety. I would say again, what Anne said earlier, that youth who don't get the services that they need when they're younger oftentimes end up being on the street when they're older, and that's due to trauma, which leads to mental health issues later in life. I think that just sort of snowball. I think that we have inadequate resources for people that struggle with mental health issues. We have a few slots for people that have significant mental health issues to access treatment. Oftentimes too, we are place-based, so we don't necessarily go to where people are. We expect them to come to us, which I think is an issue. And when you're working with someone who's on the street that's suffering from pretty significant mental illness, just asking them to show up to an appointment on time, for example, can be difficult at best. I really love the Cahoots model and having a street outreach effort where there's trained mental health professionals that can maybe link people to more intensive services that are available in the community. I don't know that our community is big enough to support a full-on Cahoots model, but I think something like that would be so valuable. There's so many times that we're working with folks and we're struggling because we know we want to get them to the services, but it's just bridging that gap is really tough. And sometimes there's not availability. Sometimes they won't get an appointment, for weeks, and we're like, they need help right now. So it can be an issue.
Great. Thank you to all the shelter providers for answering that question. Steve?
Yeah, I'll follow up with you for just a moment, Andrea. Could you just in about a minute or so outline what the Cahoots model is for our viewers that aren't aware?
I don't want to speak to it specifically because I don't know enough details, but I think the basics of it are that you're not relying on local law enforcement to respond to mental health, people that are in mental health crisis or are having a domestic, a family issue. That there's a trained team of crisis response workers that respond in addition to a police officer. I believe that they have a police officer embedded with their team in case something happens. But that really it's more of a collaborative effort between mental health professionals and law enforcement.
Great. Oh, you were going to say.
I was just going to say, I think far too often in our community, we rely on emergency services to respond to things that they're not trained to respond to, or that that could be better responded to by people trained in different areas.
So I've got two questions that have to do specifically with the perception from folks that their are homeless that do not create a problem, and there are homeless people that do create a problem. And the idea that in the viewer's belief is that it's meth, and those are the folks creating the problem. Is there truth to that sense of there's a specific kind of homeless that most of the homeless are not creating a problem in the community, and the ones that maybe are creating what are perceived as problems for the community are perhaps dealing with an addiction issue? Who shall I start with? Well, let me go ahead and I'll start with Sean.
Gee, thanks, Steve. You know, I mean, I'd kind of go back to my earlier answer that there's a lot of, this is a very diverse population. There's a large number of folks that I deal with every day who are just struggling to get by. They may have worked their whole lives and gotten injured, but not been in a job that really supported them, in terms of a retirement. So we've got an older gentleman at the shelter right now who worked his whole life in the logging industry, didn't really come out of there with a great 401k, is injured and can't work. Yep, he drinks, and that is a problem in some ways, but he's not what you would call a problem in the community, right? I mean, he's a pretty nice guy, and he's just trying to figure out how to stay alive. And then you see a lot of younger people that are in their 30s and 40s, and maybe they've had some significant trauma in their lives, particularly as children. I think Anne's comments are very germane here, that you see a lot of people that had childhood trauma, and it plays out in their adult life in a way that makes them less fully functional than you might want them to be, right? They're less able to cope with the stresses and strains of everyday life, and they're not particularly a problem. Their problem is that they don't have housing, and they don't have an income to be able to sustain that. And a lot of times people will try and cope with substances, and that can often generate a variety of problems. But I think it's a pretty small percentage of folks that really end up getting a lot of the press, right? In the business world, we talk a lot about the Pareto principle, the 80-20 rule. It's 20% of the people that create 80% of the problems, and it's probably more like 10% that really create 90% of the problems. So it's really easy to lump everybody in the same bucket, and I think that's a very common reaction in the community, is to say, oh, the homeless, this monolithic block, they're all creating, they're unsightly and trashy and, creating all sorts of problems, and we need to, worry about criminal activity. I don't think that's actually the majority of the population out there.
Anybody have anything else to add to that in terms of answer for that question? Or Anne?
I have a quick thing to add, is that I think sometimes we assume someone's homeless because they look rough, but drug users can also have homes, and there being problems. So it's not just homeless that are problems. There are people who have homes that can be breaking laws and doing criminal things and causing mischief. And you just can't tell by looking at someone necessarily. Now, if you see them in their living conditions, you could assume they're homeless, but not all the folks that you would see are actually homeless. And a lot of times drug users actually find a house to squat in. So they're not necessarily the ones we're looking at. I see Shane nodding, so.
Okay, and then, by extension, what services are available in the area for Detox, and what's available for folks that maybe don't have private insurance or defined government benefits? Anybody want to try to tackle that one? Ben.
Yeah, I can speak to it a little bit. I would say that in many cases, are services for folks who are undergoing severe substance use disorder and mental health disorder as well are difficult to access, and especially in that detox services, there's really no place for folks to get clean. I think Shane's experience of detoxing in the Motel 6 is probably a very common experience for folks. COI does offer substance use disorder counseling, but it's not something, there's a lot of room for growth in that area. And in fact, many of the folks who take us up on our counseling services are mandated by the court. They're not folks who are coming to us because they specifically want to. So I would say that there's a lot of peer support, and there is a very good 12-step network in Corvallis, I would say. But for professional detox, it's difficult to access services here.
Anybody else have anything to add on?
I could add to that.
Yeah, please.
The county also provides substance use disorder counseling and also medically assisted treatment for folks that are dealing with opiate disorders. And but again, it's difficult to get into, very much like the mental health discussion we were just having. You have to have the right kind of disorder or show up in the right way in order to get services. And it's, I often call it, you think of those children's toys where you have the star shape and the circle and the square, and you have to be exactly the right shape peg to fit in those holes in order to get the services. And it's just not the way to help people, especially someone that's on the street and has been living from day to day, who can't plan ahead and can't go through the processes to find the right door. So we don't help ourselves very well. I would say that Samaritan is helped. They have just opened up a new facility over in Lebanon that has increased the residential capacity and the outpatient capacity for substance use disorder treatment. But of course, they have to serve everyone in the state. It's first come, first serve. It's not like they can say those beds are just for Lynn County or just for Benton County or the Tri-County service area even. So there aren't enough. And one of the other big problems is that someone can, especially if they're unhoused to start with, can go into one of these residential treatment programs. But if they come out and they don't have a home, what's going to happen? Once you're back on the street and you're back with the social network you already have, the friends you're going to end up using again. So it's really hard to get straight when you don't have a roof over your head.
And Zan, we have a question like that. Okay, you've got somebody, they get out of detox, all their friends are users, all their family are users, they need to be housed in some other way. For an individual like that, what are their opportunities in this community? Sean, do you have any sense of it, or Ben, Andrea?
Wow, I'm not sure I have a lot to offer there. I mean, I do think that Zan's point is spot on, that getting out, and it's often the case that particularly if you've been incarcerated because of your use or possession or something like that, maybe you committed a felony under the influence, you may exit your treatment program with a big mark on your record that makes it extremely difficult to get housing. And I don't think that there are a lot of great options available. I think drug court can provide some housing opportunities, but it's still a limited number of spaces available.
Essentially, we're dealing with a gap.
Actually, in some ways, if you have a record or if you have a serious and persistent mental health, mental illness, you are better off because the county has housing money for folks that they are helping through their assertive treatment program if you have severe and persistent mental illness. Or if you're coming out on trans leave from prison, there are housing slots that the county can help provide you with. But if
what's the waiting list for those?
If you're coming out early from state prison, there has to be housing for you here. Otherwise, you can't be accepted into the community.
I mean, if they're coming out of, say, a detox somewhere.
Detox, it's not the same thing.
Yeah.
So it's a very imperfect system, and it's again that same question. You have to have the right present with the right kinds of problems at the right time for the right kind of money, and it's messed up. I think one of our biggest problems is that the funding streams are very, very specific for different kinds of problems, and they're not flexible enough for us to really truly braid the money and provide services that meet a person's needs, and person by person by person.
Okay, anybody got a resource that we don't know about?
I was just going to say, I think that's where Oxford houses fill a niche for people that want to be in recovery, want to live in a place with others who are in recovery and trying to be sober and maintain sobriety. It's a congregate living, it's self-governed, it's not like a supportive housing kind of opportunity, but it is one option. But
yeah, the thing of that is, my understanding, at least a few years back, we only had one of them in Corvallis. I don't even know if we still have one. It was like 11 or 12 of them in Lynn County. Do we have them here?
I don't know. I know there are a number in Lynn County.
We do have some here.
How many?
Not just one. I thought there was one women's and more than one men's, but I don't.
Okay, good. Kara, I'm going to go ahead and have you ask the next couple audience questions, if you would, please.
Okay, we kind of touched on this earlier when we were talking about mental health services, but if any of the shelter providers have anything to say about this, the viewer's asking, how much homelessness stems from families in crisis? And specifically, what are we as a city doing to intervene when a family is in crisis? So is there anybody that wants to take that?
I could take it briefly. And again, you have to show up the right way. But if a child gets into trouble with the law, our juvenile department is there to help. And they provide a very good wraparound services for families. They have a mental health counselor in their program, and they have a caseworker for each child. And the philosophy that they take is that they work with the whole family. They work with Jackson Street Youth Shelters on a very regular basis. They work with DHS on a regular basis, and try to look at the family as a system rather than just the child, because it's usually not the child's problem. It usually is the family that has challenges, as Anne has already pointed out. But again, why do kids have to get in trouble in order to get the help? That's where I have a problem with the system as we've set it up right now. We need to be doing a lot more prevention rather than catching kids after they've already stumbled.
Thank you. Does anybody else want to add to that?
I'll just say that again, we've kind of said that every situation is so unique. But I'm gonna tell you a quick story in that, say you have a youth, they're home, it's COVID, their parents are divorced, their mother has a boyfriend who has a child, and they spend a lot of time yelling and screaming in the household. The child is trying to get their homework done because it's COVID, and they've got a small house, and then they're in the living room. They're missing their father, and this just sounds like, okay, this is sad, but it quickly turns when that youth then becomes depressed, that youth becomes suicidal, that youth wants to run away, the parents kick them out, they become homeless, they become sexually victimized, and they have trauma, and then they have to turn to drugs. So you see, what your question is really right on. You've got to help families, and they're struggling, and COVID is only making it worse. So I would just say, yes, that is definitely an issue, and we need to address it.
Thank you, Anne. Ben, I saw that you might want to say something. Do you want to add to it?
Yeah, I was just going to say that I'm not sure I understand the question completely, but I would say that the families who live at COI are all in crisis. Being homeless is a crisis. Not having a place to live is a crisis. And so it's really traumatic for everybody. And it's not a place that you would choose to go if you had a better place to be. So, I would say that families in crisis, yeah, homelessness is a crisis.
Thank you. The next question I have is for Zan, which is pretty relevant since we just had an election. How can homeless people without an address retain their right to vote? And what does the county do so that the homeless know that they can vote?
That's a really good question. But my assumption is that as long as they have an address where they can receive a ballot, they can vote. And I know that an awful lot of our unhoused population receives mail either at COI or at the daytime drop-in center. So that would be my recommendation, is to make sure that they have a place to receive mail so you can receive a ballot, and anyone can register to vote online here in Oregon. And I'm sure that there are folks that would be willing to help with that at the Corvallis Daytime Drop-In Center or at COI.
Thank you. Okay, so Steve, if you want to ask the next question.
Sure. We actually have a group of questions. I'm going to kind of roll through them fairly quickly, but they don't entirely lend themselves to quick answer, and I know that. So firstly, there's just this view that housing is just so incredibly expensive, and that on some level, something has to happen with affordable housing as a means of preventing homelessness. And then also kind of along with that, and I think I'll start with Biff and Zan on this, that a lot of the housing that had maybe been formerly affordable kind of gets torn down. It's built for student housing, at least the space is then used for student housing, is at least a perception of this particular viewer. And their question has to do with what's happening to build more affordable housing. Is there even a way to do that? Biff, I'll start with you.
Well, there's a lot going on, and has been going on for a number of years now, to try and get at this problem. Corvallis has a severe housing shortage, and it's across the board. It isn't just low-income affordable housing. It's housing at multiple incomes, workforce, middle income, as well as low and very low income housing. And there are different programs that work in different areas, whether it's funding to actually build very low income housing so that those who have well below the median income for the area incomes, that you have more housing. And that I could go through a number of things that we have been moving forward, one of which a key milestone last year was the South Corvallis Urban Renewal District, which a key part of their major part of their programs had to do with beginning to help fund and provide affordable housing. And in that case, that's things like, as you deal with the tax increment financing, you're able to then build some of the infrastructure so the housing that gets built can fit better in that. But in Corvallis, we need to do some significant things to get different types of housing built so that even for the workforce housing or middle income housing folks, they're able to find housing in town. I'm trying to think, it was more than 6 years back, we kicked off a housing study in Corvallis, and people who worked here but didn't live here, 40% of them wanted to live here. What are the reasons why? Cost was part of it for these people who were making reasonable money in a job, but another part was availability. And then you start looking at, well, why is availability short? Because the buildable land in Corvallis is short. And so over the past 2 years, one of the priorities in the city was to identify places where we could create medium and high density housing zones, so that then there's an opportunity to be able to build housing that has that middle income kind of housing, so that you don't have people who are in the middle income who want to stay in Corvallis using more affordable housing that could be affordable to those who are making less than them. There's this cascading problem that goes on as well. So I not being prepared to go through the whole list of them, these are just some of the examples of where we've gone in terms of rezoning and in terms of trying to improve our land development codes and the like, so that it is there's less upfront in the way of costs that have to occur dealing with the processes and procedures and approvals, and things become more matter of fact. And that's a multiple year project, a multiple year effort that it takes us having to keep pushing on that.
And then specifically, questioner wants to know, is there some way that you can zone a tiny house village, even if the housing is maybe not built as to the normal specifications? Any reason we can't zone one of those?
Not being the zoning expert, my sense is no. In fact, already there's tiny house zoning possibilities. There is also cottage housing zoning that exists. Part of what we're looking at right now is through the next year and a half about upgrading our codes is to enable more of this cottage housing. So you begin to imagine cottage housing being a cluster of tiny homes. And we have some examples of cottage housing in town here, but there's a lot of potential opportunity there, but that's part of working through and balancing the zoning.
Zan, same questions, really.
Okay. I would say a couple of different things. One, that if we are willing to accept more travel between communities, we see that there is a pattern of construction that's going on outside of Corvallis. So Philomath has added a lot of new residential capacity in the last year, and they're continuing to do so the last couple of years. Adair Village, likewise. Monroe has a new housing development as well. So we are adding capacity outside of town, and there are people moving from Corvallis to some of these other places, freeing up some housing capacity. I would say that COVID has done a few favors. It's made housing prices a little bit more affordable, and rents have come down a little bit, just because there aren't as many students in town. So it's also meant that there are a few more houses that have been rentals for years that are in tough shape that are coming on the market, that are becoming family occupied houses again. So there are some interesting dynamics. But I would also like to mention that one of the problems in Corvallis is that it's expensive to build. And so you really can't build low-income housing without subsidy. There are low-income housing tax credits. Those are going to be used, for instance, to build low-income housing on 53rd Street, Commonwealth Development, that will be coming along sometime in the next year and a half or so. But we have some of the lands here in South Corvallis, where I am. Dev Northwest, a nonprofit builder, is having trouble putting together their development plans because the prices that they'll be able to charge for rent aren't sufficient to actually pay off the cost of building the houses. And what we really need is people that are willing to invest in that differential to buy down the price per house, the price per unit, so that we can go to the state or to the federal government for funds. Because what we have found here in Corvallis is that often our low-income or moderate-income housing proposals aren't competitive because we are priced out of the range of all of the other proposals that go in. And if you can build 200 houses over there in Lapine, but you can only build, 80 here for the same amount of money, where's the state going to put the funds?
And Jolie, by extension, on the tiny house community model, maybe you're familiar with Community First outside of Austin, Texas, something like that. Is that a workable model? And you're muted. Oh, there you go.
This is for me. I heard Jolene.
Yeah,
but
no, Jolie. Yeah.
Julie.
Yeah, sorry.
I'm not familiar with the one in Austin. The tiny home village that I am familiar with is down in Eugene, Square One Village and Emerald Village. And it is a very successful model. And Square One villages have come up here to Albany.
How many units do they have?
I don't remember the exact unit number. Sean, you probably know more than I do. For the past many years, a lot of our community providers, including Alita Hess-Holcomb, have tried to really develop relationships with
Yeah,
the
Sean, do you know how many units that is?
I was just trying to pull it up on Google. I can't remember how many it is, but It seems like it's in the 20 range, but I'm not to
I was
that.
going to say, I think Emerald Village is around 18 houses. And they're very, they range from like a couple hundred square feet to maybe 300 tops.
Okay.
And that's a co-op model where they are considered homeowners, but they don't own the land. So if people get to where they want to move on, they can get, they can't
There's some equity.
you, but they do get some stipend that they can use to go put a down payment on another apartment or another place to live.
Okay, great. And then the next question comes down to inclusionary zoning. I think that's the term. I could have that wrong. Where if the observation from the viewer is that there's hundreds of units been approved in the last few years. Could we start making approval contingent on some amount of a development being built out as affordable housing, Biff?
The simple answer is no. The state took that right away from us. And that was something that probably 5 or 6 years ago, I was trying to do some lobbying for as it became clear. Now, there's other economic reasons, whether that is something that works or doesn't. And there's a lot of debate in the housing world as I try and read that. So given we cannot do that, we're doing things like the subsidy Zan talked about, or trying to support that, but also build enough land so that they get to the point where there's enough vacant land that could be built for different uses, that the land cost is not the thing that gets built on, that then builds up this whole pyramid of the only thing you can sell is a $500,000 house. Because if you're only doing a few units and you're doing a few units that the land is very expensive for, and then all the stuff you do to prep that land, sewer and water and streets don't get spread across enough units, the economics don't work out except for something which is more than a market niche that you need to have. And so, yes, developers want to make money at a particular level. What can we do as a city to deal with our zoning, to be able to deal with trying to improve the situation so that we have land that's available and we're not forcing.
And I now seem to recall you actually lobbying for. Yeah. Okay. I see. Yeah. Right. I think I recall. Yeah.
Yeah.
Okay. I'm going to move over to Kara. These next questions. Let's go ahead, and we're getting towards running out of time. Let's go to about a minute per answer. And Kara, go ahead.
Thanks, Steve. This question can be posed to anyone, so if anybody feels particularly passionate about it. This questioner has a perception that there's people in Corvallis that are choosing to live without a home. And they're questioning, are they the ones that are creating a problem? And what is the community's obligation to someone choosing homelessness? Does anybody want to speak to that?
What I would say about that is that if your experience in life has been mostly while you've been in housing, you've experienced abuse, or you've been evicted, or you've had some other traumatic experience when you've been in housing, and you've decided that that's just not something that's possible for you. When someone asks you if you're choosing to be homeless, you're going to say, yeah, you might say yes, because you might think that's the only thing that's possible. And so I would be cautious about when people say that they're choosing homelessness, if that's something that they really want. I think that that's a common perception that's untrue.
Thank you. Does anybody have, Shane, did you want to add? Go for it.
I know that when we first arrived here and we stayed at COI, you know, I'm a gregarious guy, so I talk to everybody. And going downtown around the skate park area here in Corvallis, you know, there's a large percentage of youth down there. There's it used to be a popular little spot for the homeless folks to hang out, and you know, you'll hear people say that, you know, I'm choosing to be homeless. They're choosing most of the time to be homeless instead of And that's the thing. It always boils down to, like Andrea said, it's maybe an issue at home. It's maybe, unresolved issues that, like in my case, when I bring it back to me, it's, I carry a certain amount of guilt for my past. And then on top of that, it's stressful for me to be in here, because even though I know that my place is really secure, honestly, there's not a day that I wake up where I'm not stressed about losing my place. And it's unrealistic, I know that, but it doesn't change the effect that it has on me. And I know that a lot of these folks that I spoke to, it was, well, in order for me to get a place, I've got to do this and this and this and this and this and this. It's overwhelming. And sometimes it's just easier to say, well, I'm choosing to be homeless. It's not a choice. No one thinks that sleeping outside for the rest of their lives is better than sleeping indoors. No one that I've ever spoke to, and I've spoken to many, many people in many different situations, no one is ever wanting to spend the rest of their life outside. It's that conditioning that I was talking about earlier. They understand what you want to hear, and that's what they're going to present to you for a lot of the points. It's there. For me, it was, I just didn't feel like, people care, so I'm going to tell them what they want to hear. One of those things is, I choose to be homeless.
Right.
I wasn't choosing to stay homeless. It was just, I was still dealing with unresolved issues. And even now, like I said, I every single day I wake up with that same stress, and then we've been here a year now, and it's still every single day I wake up with that stress. So saying that they choose to be homeless, yeah, I think, like Andrea said, it's more of a coping mechanism. It's more of a way of them, downplaying everything else, if that makes any sense.
Thank you for sharing that, Shane.
Yes,
Steve?
We have a number of questioners that have asked a similar question. Why not, in an emergent circumstance like we have with COVID, instead of people needing to be in tents, are we not using buildings at the fairgrounds or the old Kmart, or fill in the blank large volume space buildings that are currently either not used or underused? Why is that not happening? Zan?
I can take a first step, but I think Sarah probably knows the answer even better than I. We are doing some of that. The fairgrounds has several campsites that are being used to house folks that are in RVs and cars that are homeless, experiencing homelessness.
Are we using any of the buildings?
We are not using the buildings, and for a variety of reasons. I'm going to pass it to Sarah to talk about those, because
Sarah?
she's been in the nitty-gritty.
About 1 minute, Sarah.
Yep, we've looked at a lot of different options, and one of the reasons why we didn't utilize the indoor part of the fairgrounds, one is because it's a congregate shelter, and we really wanted to look at non-congregate spaces because of COVID. Two, we wanted to reserve the fairgrounds for another emergency mass sheltering need. At that time, we were thinking potentially overflow from the hospital from COVID. As it turns out, we ended up using it as an evacuee site for wildfires. So we have looked at other, and when I say we, I mean everyone in this on this panel has looked at empty sites around Corvallis to be utilized for this purpose, whether it be an old sorority or fraternity, the Kmart building, the parking lots. We've, the auction yard, we've been looking for other options, and that's not done. But we do have RV car camping spaces at the fairgrounds. We have 10 for medically vulnerable folks. We've contracted with Chance Recovery to get folks into motel sheltering. So we have about 30 spaces for motel shelter. And then, of course, folks have mentioned the micro shelters and the other solutions that we're trying to throw at this crisis on top of a crisis.
Last question for the night will be this: Have we been asking the homeless folks what it is that they feel is necessary? And I'm going to just 10 seconds from anybody who wants to answer. And in what way are we doing that? I'll start, let me go ahead and start with Sean.
I was going to suggest you start with Julie because she's got a survey out that's roughly asking that question.
Now, that's for the general public. Is that for homeless specific?
Well, I think there's both.
We have one client one survey specifically for clients, and it was developed in conjunction with providers who are still serving clients in person, and I'm delivering them tomorrow and Thursday.
I think that is the most, that is just answers it. I think that's great. I want to thank all of you for showing up here. Please hang out past the all clear so we can speak with you privately for a moment. Really appreciate you taking time like this. For those of you that are viewing, thank you for viewing. If you're not a subscriber, please consider going to the Corvallis Advocate site and spending $5 or $10 a month supporting forums like these. Kara.
Thanks, Steve. CitySpeak will return in January after the holidays, so happy holidays to everyone if you celebrate. And thank you again to everyone who makes these forums possible, our panelists, the advocate staff that do all the work behind the scenes, our supporters, and viewers like you that choose to subscribe. As always, we also want to thank Peak Sports and First Alternative Natural Foods Co-op for their support. With that, the CitySpeak is adjourned. Good night.